We had a very nice response to that. His hips are much freer without me having directly treated the hip joints. His rotation now is to 20 degrees and there's a soft end feel. The mobility through the pelvis is much freer. I can now load and spring his pelvis posteriorly, and that's valid on both sides. I can glide his pelvis now from the right to the left, and I can add a spring test at the end of that, and there's additional mobility. Lie on your stomach. The sacrotuberous ligament is now softer. I can now indent that. There is superior mobility. There is inferior mobility. There's forward rotational mobility. On the sacrum, I can spring it, and the force goes through the SI joint down into the hip joints and into the lower extremity. When I spring that, I see movement in his feet. The position of the sacrum is now deeper. My left thumb is now higher than the sacrum. So if I slide across, I overlap my right thumb that's on the sacrum. So we have improved anterior glide of the sacrum and posteromedial glide of each ilium. And this has a whole body response. The typical injury that causes this is a fall on the buttocks, and the trunk hyperflexes and it pushes the sacrum, wedging it posteriorly. The other mechanism of injury is delivering a very large baby. So we know that somewhere in his life Tom must have fallen on his bum. So can you tell us how you felt walking after we treated this?
Yeah, my pelvis and hips felt looser. They were moving side to side better, and you could see that my arms were swinging. I wasn't as rigid or stiff in my gait.
So do you feel like your whole body was less rigid?
Yes, I would say that.
Very good. Yeah, you looked a lot better walking. Mm-hmm. And this pattern is a pattern I discovered, and I named it posterior glide sacral fixation. And I've shown the treatment. The treatment is very straightforward, and the response in this example is very dramatic. And that's all I have to say. Thanks.